Baroness Bennett of Manor Castle.
My Lords, I beg leave to ask the question standing under my name in the order paper.
My Lords, the Health and Safety Executive, HSE, is not currently considering restricting the use of engineered stone. The control of substances hazardous to health regulations already require employers to put in place measures to prevent workers being exposed to respirable crystalline silica. This includes adequate controls ensuring compliance with the workplace exposure limit and health surveillance identifying potential ill health. HSE keeps requirements for reporting occupational diseases under review and is not currently making silicosis reportable.
I thank the Noble Lord the Minister for his answer, but of course Australia acted after it found that 1 in 4 stonemasons had incurable, debilitating and sometimes fatal silicosis. Estimates suggest that in the UK 1,000 people die a year from silicosis as a workplace disease, and many more suffer from debilitating conditions. Those are not just stonemasons, but are also construction workers, engineers and agricultural workers. Surely the government should at least be looking into this issue further and looking to get more data on a problem that Australia, broadly comparable to us, has found to be absolutely crucial and essential to act.
Well, I'm pleased that the Noble Baroness has raised this point. I think she will know that HSE is different from Safe Work Australia in that Safe Work Australia don't act as a national workplace regulator, and instead they set policy. And it is true that from our figures, Australia have reported 260 cases of silicosis. A significant number of workers, however, using engineered stone in Australia are also known to be SMEs or sole traders who remain hard to reach. But to answer the Noble Baroness's question, we are very much in touch with Australia on this important matter.
Favours is participating remotely.
My Lords, I welcome this important question as someone with former downstream involvement in the industry. Can I suggest we confine any debate on further restriction to the dry cut of granite, cement and quartz, and not other products? Engineered stone is primarily quartz. If cut wet, there's little problem. If cut dry, it can lead to dust and lung problems and may well require further regulation. This is a problem primarily in Europe, as there's very little dry cut activity now in the United Kingdom.
The Noble Lord is right and has made some very helpful comments, and he's right that individuals are most at risk when dry cutting and polishing are being performed. And in Great Britain, I think, as the Noble Lord was alluding to, engineered stone is mostly imported in. But he makes an interesting point about the amount of silica content found in engineered stone. Yes, it's high, but sandstone also has 70 to 90% in it, granite 25 to 60%. And the Health and Safety Executive and COSH are very much, over many years in the past, having taken good measures on that.
I'm not very reassured by the Noble Lord Minister's comments about the British health and safety precautions and enforcement. I wonder if he could explain in greater detail what we're actually doing rather than hoping this will just go away, and are there cases increasing, and are there numbers, not Australian numbers, but UK numbers of illness from these causes?
First of all, in contradiction to what the Noble Baroness Lady Bennett was saying, our information is that nobody has suffered any long-term exposure to silicosis, although there are some instances of non-compliance, which has reduced from 19% to 11%. But in terms of actions, I think that the Noble Lord should know that HSE has been tackling the issue of exposure to RCS for many years through a mature regulatory model which combines targeted inspection activity and high-risk activity, communications activity and working with stakeholders.
My Lords, the issue of silicosis and stone grinding has been known since the 1940s, when it was described, I think, first by the late Dr. Donald Hunter, who was an expert on industrial disease, and he recommended a number of precautions. What I wonder is whether or not we've looked to see now whether the precautions which are available and which should be enforced are aren't clear and the government understands them? And are they similar to the ones that were introduced in Australia?
Well, indeed, and I think perhaps I can reassure the House that actually, as mentioned before, most of the engineered stone is imported into the UK. So where there is a particular issue, or could be an issue, is where engineered stone is used for fitting kitchen worktops. And that's where, of course, understandably so, it's difficult to monitor the importance of having PPE and having masks on. And that's an area that, again, over many years going past, HSE and COSH have been very much been looking at.
Lord Minister, explain what the reluctance, what's behind the reluctance to make silicosis a recordable disease? Because if we did so, we'd be able to monitor the size of the problem and put in further preventative interventions, and thus in the long term save the public purse both in NHS and benefits system.
Well, indeed. The Health and Safety Executive recently carried out a post-implementation review, a so-called PIR, of REDOR, which the Noble Baroness will know will be the reporting of injuries, diseases and dangerous occurrences, with a view to expanding it to include areas where HSE regulatory intervention can add value. We are starting, HSE will start the process of reviewing the remaining recommendations, including the inclusion of pneumoconiosis, which is in effect silicosis, within the next business year.
My Lords, the HSE's own website says that silica is the biggest risk to construction workers after asbestos. And as the Minister said, it's found in engineered stone, which is used extensively in kitchen and bathroom for countertops. Now, the UK has a silica exposure limit of 0.1 milligrams per cubic metre. Now, I understand that's twice the legal limit in the United States and Germany, and 4 times that in Portugal. So, my Lords, could I ask the Minister, has this been looked at recently? And is he aware that, I think it was only in 2015 that the first case in Australia was found as someone getting silicosis, and since then hundreds more cases have come online. In Australia, this has been talked about as the asbestos of the 2020s. So can I urge the government not to be complacent about this?
The Noble Baron is absolutely right, and I should perhaps reassure the House that Great Britain has a very good record in this area, and the European Union reflects our approach. For example, the silica limit in Great Britain, as the Noble Baroness has pointed out, is 0.1 milligrams per metre cubed, which was set in 2006 and is now comparative across the world. And the EU considered a lower limit, however it was not adopted. And this was due to uncertainties about the reliability of measuring techniques at below the limit that we're at.
The Minister seen reports in the Scottish media that part of the Stone of Destiny has been taken into private ownership by a member of the Scottish National Party. Which department is responsible for recovering this, and what are they doing about it?
Can I say, certainly not mine.
Lords, one of the problems with silicosis is that it is not necessarily diagnosed by doctors and recorded on death certificates. And one of the problems leading to that is that it's not a well-recognised condition apart from amongst experts. So deaths which are consequent on chronic obstructive you know the word I mean, COPD, don't necessarily record silicosis. Does His Majesty's Government support the recommendations of the APPG on respiratory diseases, and in particular the need for an industry awareness campaign on silicosis?
Yes, and the Noble Lord makes some very good points, but can I perhaps reassure him that the current HSE silica intervention continues to raise awareness of the requirement to adequately control exposure to RCS, not only in the construction sector, but also those providing materials for construction, such as brick manufacturers and stone fabricators. And these campaigns will continue through 2024.
I think the sense of complacency has been very, very strong. I just draw the Noble Lord's attention to the fact that in many cases exposure to silica is producing diseases in young people aged 19 to 26. That's something experience that Australia had. is the government considering, given the concern about the health and well-being of our workforce, that this and other issues in workplace safety are a significant contributor to our problems with so many people of working age being unable to work because of health?
Well, it's easy to say from the Noble Baroness that we're complacent. We're not. I think I've laid out a number of actions that were taking place. HSE has said and continues to deliver inspection campaigns in industries associated with RCS exposure. HSE also investigates concerns about inadequate risk management. That's been going on for many years. And I mentioned the post-implementation review, and HSE will start the process of reviewing the remaining recommendations, including the inclusion of pneumoconiosis, within the next business year, as I said earlier.
Third oral question, Baroness Randerson.